Emergency medical services in rural areas are less likely to reduce pain in trauma patients, provide proper care to kids with asthma attacks, and are more likely to use lights and sirens unnecessarily, according to a study published Tuesday, adding to previous research that found rural health systems struggle more compared to urban and suburban areas. The national average from the time of a 911 call to arrival on scene is 7 minutes, but that time doubles to 14 minutes in rural areas, and around 1 in 10 encounters take 30 minutes, according to a 2017 JAMA study. While fast response times are essential for rare, critical incidents, like when a patient's heart stops beating or someone chokes, the vast majority of patients benefit from condition-specific clinical care in the early stages of a medical emergency. Lead author Michael Redlener, an associate professor for the Icahn School of Medicine of Mount Sinai, said in a statement, "Rural communities have worse or struggling medical systems because they're often isolated from bigger cities, and they tend to have a shortage in doctors," according to the National Institutes of Health. EMS agencies in isolated areas respond to more critical, life-threatening calls that require more timely response times than suburban and urban EMS providers, mainly because rural areas are poorer, older and sicker. Large geographic areas with scattered populations, longer travel distances and challenging weather conditions and terrain are all factors into longer dispatch times in rural communities, the federally funded Rural Health Information Hub says. Another factor at play is the closure of hospitals in rural areas. There were 136 rural hospital closures between 2010 and 2021, with a historic 19 in 2020 alone, the most of any year in the past decade, according to a 2022 report from the American Hospital Association. Hospital closures mean still standing hospitals have an increased coverage area. Rural ambulance travel times increase 76% in the year directly following a closure, a 2019 University of Kentucky study found. The use of sirens and flashing lights by ambulance vehicles has been a long debated topic within the medical community. Lights and sirens are meant to decrease response and transport times, and research suggests they cause a modest reduction in EMS response time between 1.7 to 3.6 minutes, and reduce transport time between 0.7 to 3.8 minutes. However, some argue they do more harm than good. The risk of crash more than doubles when emergency vehicles use lights and sirens while transporting a patient, according to the National Safety Council. The rate of injuries in EMS workers is almost 15 times higher when ambulances use lights and sirens compared to when they don't. Researchers looked at how many patients who were transported using lights and sirens received interventions at the hospital, and only 4.5% of patients got this type of intervention.